Hello, this is Golden Age Lab. Today, I'm going to share something that might shock you, but it's crucial information you need to know. Do any of you eat broccoli every day for your health? I'm sure many of you do. We see it on TV and in health programs. Broccoli prevents cancer. It's good for your heart. You probably pick up a bag every time you go to the supermarket. But here's the thing. Did you know that this supposedly healthy broccoli can actually be dangerous for some people? I'm not exaggerating. In 1983, a case was published in one of America's most prestigious medical journals, the New England Journal of Medicine, titled Warfarin Resistance Caused by Broccoli. What this means is that a patient's blood-thinning medication completely stopped working after they started eating broccoli. This was medically documented. Can you imagine how dangerous that is? So today, I'm going to explain, based on scientific research, why broccoli can be dangerous, who needs to be especially careful, and how to eat it safely. Even though this will be a bit long, if you stay with me until the end, it will help protect your health and your family's health. First danger, broccoli, that destroys your thyroid. Let me start with the first hidden danger of broccoli. Thyroid problems. You've heard of the thyroid, right? It's a small, butterfly-shaped gland in the front of your neck. That plays a crucial role in regulating your body's metabolism. Broccoli contains something called goitrogens. That's a difficult name, isn't it? Just think of it as thyroid-blocking substances. These substances interfere with your thyroid's ability to function properly. What happens when your thyroid doesn't work right? You feel tired and lethargic. You get cold easily. You develop constipation, and in severe cases, you can even become depressed. People who eat a lot of raw broccoli are especially at risk. These days, many people eat raw broccoli salads for dieting, right? Well, that can be a problem. The good news is that cooking reduces these harmful compounds. According to medical literature published in 2022, steaming broccoli reduces goitrogens by 1/3, and boiling it for 30 minutes eliminates up to 90%. This is really important information. It means you can significantly reduce the risk just by changing how you cook it. So who needs to be especially careful? People who already have thyroid problems. If you've been diagnosed with hypothyroidism, or if you take thyroid medication every morning like levothyroxine or Synthroid, you should not eat broccoli carelessly, especially not raw. According to information from major American hospitals, people with hypothyroidism should eat a balanced diet and cruciferous vegetables. Like broccoli should only be eaten cooked and in moderate amounts. Medical nutrition information recommends that people with hypothyroidism limit broccoli to about 5.5 ounces, about 160 grams per day. That's about a palm-sized portion. Here's another important point. For pregnant women with thyroid problems, research published in 2017 recommends eating seaweed rich in iodine while avoiding goitrogen-containing vegetables, like broccoli and cabbage. This is because it can affect the baby's thyroid development. So how should you eat it? There are ways. First, always cook your broccoli. Boiling or steaming, it reduces the harmful compounds by 30 to 60%. Second, control your portions. About 3.5 ounces, about 100 grams per day. Roughly a palm-sized portion is enough. Don't eat it every day. 3 to 4 times a week is better. Here's another tip. Eat seaweed at the same time. Seaweed contains a lot of iodine, which helps your thyroid. Having a seaweed salad with your broccoli makes it much safer. Second danger, the dangerous combination of blood thinners and broccoli. Now for an even scarier story. Are any of you taking blood-thinning medication? I'm talking about drugs like Warfarin or Coumadin. These are medications people take for heart problems or to prevent blood clots. If you're taking these medications, eating broccoli can be really dangerous. Why is that? Let me explain. Broccoli contains a lot of vitamin K. Just 3.5 ounces, 100 grams of broccoli, contains 64% of your daily vitamin K requirement. Vitamin K makes your blood clot. That's why bleeding stops when you get hurt. But warfarin does the opposite. It thins your blood. If blood clots too easily, you can develop dangerous clots in your heart or brain. So the medication thins your blood. So broccoli's vitamin K and warfarin work against each other. If you eat a lot of broccoli, the medication stops working entirely. In fact, a case report published in the New England Journal of Medicine in 1983 describes a woman taking 7.5 milliliters of warfarin daily. After she started eating broccoli, her prothrombin time shortened. The doctor increased her dose to 20 milligrams, but it still didn't work. Upon investigation, they discovered she was eating broccoli. When she stopped eating broccoli, everything returned to normal. Do you see how dangerous this is? If the medication stops working, your blood can clot and cause a stroke or heart attack. A 2004 paper in Home Healthcare Nurse titled Of Blood, Bones, and Broccoli Warfarin Vitamin K Interactions discusses this interaction in detail. Additionally, drugs.com, an American pharmaceutical information website, warns that suddenly eating large amounts of vitamin K-rich foods like broccoli, Brussels sprouts, kale, and spinach, or drastically changing the amounts you eat, can affect warfarin's effectiveness and safety. So if you're taking blood thinners, remember this. It's really important. First, if you want to eat broccoli, consult your doctor first. Second, if your doctor says it's okay, you must eat the exact same amount every day. Never eat a lot one day and none the next. That makes the medication work unpredictably and is dangerous. According to medical information from GoodRx, people taking warfarin need to keep their vitamin K intake consistent and sudden. Dietary changes can affect their INR international normalized ratio, a measure of blood clotting. The safest approach is to eat only about 175 ounces per day. That's a small handful, and you need to get blood tests more frequently. Instead of once a month, go every 2 weeks to check your INR. INR measures how quickly your blood clots. Actually, there are many other vegetables high in vitamin K besides broccoli. Spinach, kale, collard greens, and mustard greens are the same. So if you're taking blood thinners, you shouldn't eat large amounts of these leafy greens. Instead, eat vegetables like cucumber, squash, carrots, and eggplant. These vegetables are low in vitamin K. One more thing, people taking warfarin should also be careful with multivitamins. Some contain vitamin K. When buying vitamins at the pharmacy, ask the pharmacist, "I'm taking warfarin. Can I take this vitamin?" Third danger, bloating and digestive problems. Now for a problem many people experience, bloating and gas. You've heard the saying, broccoli makes you gassy, right? It's not a joke, it's true. Broccoli contains something called raffinose. The name is complicated, but simply put, it's a complex sugar that our bodies can't digest. What happens is, when you eat broccoli, this raffinose passes through your small intestine and goes down to your large intestine. Then the bacteria in your large intestine ferment it and produce gas. That becomes flatulence. For healthy people, a little gas is fine. It's embarrassing, but not a big problem. However, for people with digestive issues, especially those with Irritable Bowel Syndrome (IBS), it can be really painful. What's IBS? It's a condition where stress causes stomach pain, diarrhea, or constipation. It's very common in America. Health information sites classify broccoli as a high FODMAP food. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Just think of it as foods that don't digest well and create a lot of gas. According to research, about 75% of IBS patients improved with a low FODMAP diet. Since broccoli is a high FODMAP food, IBS patients should avoid it. So should people with sensitive stomachs never eat broccoli? Not necessarily. There are ways. Let me tell you. First, start with very small amounts. Just 1 ounce, about 30 grams at a time. That's a small handful. Don't eat a lot right away. Give your body time to adjust. Second, never eat it raw. Boil or steam it thoroughly. Cooking makes it much easier to digest. Boil it in water for at least 5 minutes, or steam it for about 10 minutes. Third, chop it very finely. Large pieces are harder to digest. Cut it into small pieces with a knife. Fourth, you can find digestive enzyme supplements at the pharmacy, like Beano or Gas-X. If you take these before eating broccoli, you'll produce less gas. Beano especially contains an enzyme called alpha-galactosidase that helps break down raffinose. Fifth, drinking ginger tea with your broccoli helps digestion. Ginger promotes digestion. Have a warm cup of ginger tea with it. If you have irritable bowel syndrome, Crohn's disease, or inflammatory bowel diseases like ulcerative colitis, honestly, it's better to avoid broccoli altogether. Instead, eat low FODMAP vegetables like zucchini, carrots, and eggplant. They have similar nutrition but are much easier on your stomach. Fourth danger, potassium problems for people with kidney disease. For people with kidney problems, especially those on dialysis, broccoli can be really dangerous. Let me explain why broccoli contains a lot of potassium. Potassium is an essential mineral for our bodies. It regulates blood pressure, helps muscles move, and keeps the heart beating. But if your kidneys aren't working well, this potassium can't be eliminated properly. Then potassium builds up in your blood, which is really dangerous. Your heart rhythm becomes irregular, and in severe cases, your heart can stop. According to research published in the Journal of Nephrology in 2020, hyperkalemia high potassium levels is common in patients with chronic kidney disease (CKD). This is related to decreased kidney function and medications used to control diabetes and heart failure. Hyperkalemia increases the risk of cardiac arrhythmia and sudden death. A large-scale study published in Archives of Internal Medicine in 2013 analyzed 66,529 cases of hyperkalemia and found that the incidence was much higher in patients with chronic kidney disease who were also taking ARBs blockers, a type of blood pressure medication. According to the National Kidney Foundation, broccoli contains about 316 milliliters of potassium per 3.5 ounces 100 grams. So it's classified as a high-potassium food that kidney disease patients need to be careful with. Generally, foods containing 200 milliliters or more of potassium per serving are considered high-potassium foods. So can people with bad kidneys never eat broccoli? There are ways. There's a special cooking method to reduce potassium. It's called leaching, recommended by the National Kidney Foundation. It's a bit complicated, but it works. Listen carefully. First, chop the broccoli very finely. The smaller you cut it, the more potassium leaches out. Second, soak it in warm water. Use 10 times as much water as vegetables. For example, 1 cup of broccoli needs 10 cups of water. Soak for at least 2 hours, and if soaking longer, change the water every 4 hours. Third, drain and rinse once more with warm water. Fourth, boil in fresh water. This time, use 5 times as much water as vegetables. If you have 1 cup of broccoli, use 5 cups of water. This significantly reduces the potassium content. But honestly, it's much better to just eat low-potassium vegetables from the start rather than going through all this. Vegetables like cucumber, boiled cabbage, eggplant, and lettuce are low in potassium and safe for people with kidney problems. It's best to consult with a registered dietitian to create a meal plan that's right for you. According to a 2019 Italian Society of Nephrology, serum potassium levels of 5.00 OMQL or higher in chronic kidney disease patients should be considered pathological and require prevention and treatment strategies. Here's something I want to emphasize for people with kidney problems. It's not just broccoli. Bananas, oranges, tomatoes, and potatoes are also high in potassium. When your nephrologist gives you dietary guidance, listen carefully, take notes, and refer to them when preparing meals at home. Fifth, danger drug interactions. A hidden time bomb. The last danger I want to talk about is drug interactions. Many people mistakenly think natural foods don't interact with medications, but that's absolutely not true. Food affects our bodies just like medications do. Besides Warfarin that I mentioned earlier, there are many other medications you need to be careful with when eating broccoli. If you take thyroid medication levothyroxine, Synthroid, Livoxil, etc., you usually take it on an empty stomach in the morning, right? You should wait at least 4 hours after taking your medication before eating broccoli. If you eat them together or too close together, the medication won't be absorbed properly. People taking diabetes medications like metformin or sulfonylureas also need to be careful. Broccoli itself has a slight blood sugar lowering effect. So if you eat it with diabetes medication, your blood sugar might drop too low. When blood sugar drops too much, you can feel dizzy, break out in cold sweats, have shaky hands, and feel confused hypoglycemia. In severe cases, you could even faint. Some blood pressure medications also require caution with broccoli, especially medications that cause potassium retention like spironolactone, ACE inhibitors, and ARBs. If you eat a lot of broccoli while taking these, your potassium levels can get too high. So if you're taking any medications long-term, consult your doctor or pharmacist before eating broccoli. Just ask, "I'm taking this medication, can I eat broccoli?" Look at your prescription bottle. It has the medication name on it, right? Take a picture of it. Then when you go to the doctor or pharmacy, show them the picture and ask. It's easy with smartphones these days. Also, if you take dietary supplements or vitamins, be careful. Some multivitamins contain vitamin K. If you're taking blood thinners, you should ask your doctor before taking these supplements too. So how should you eat broccoli? After hearing all this, you might be thinking, so should I just never eat broccoli? Absolutely not. Broccoli is still an excellent vegetable. It prevents cancer, strengthens your heart, and has lots of antioxidants that slow aging. The issue is how you eat it. Now let me tell you how to eat it safely. First, know your health status. First, you need to know your health status accurately. Do you have any of the conditions I mentioned? Thyroid problems, kidney problems, frequent stomach pain? Are you taking medications long-term? If so, you must consult your doctor before eating broccoli. When you go to the hospital, ask, "Can I eat broccoli? How much can I eat?" Your doctor knows best. According to information from major American medical institutions, broccoli eaten as a side dish is safe for most people. So if you eat it in moderation, it's fine. However, you should avoid eating excessive amounts or taking it as a dietary supplement. Second, control your portions. Even healthy people need to control their portions. No matter how good a food is, too much becomes toxic. The same goes for broccoli. How much should you eat per day? About 3.5 to 5 ounces, 100 to 150 grams, roughly a palm-sized portion, is enough. Imagine spreading your hand flat and putting broccoli on your palm. That's the right amount. This gives you enough nutrients without any risk. Don't eat it every day. 3 to 4 times a week is good. Like Monday, Wednesday, Friday, every other day is perfect. Eating it daily allows it to accumulate in your body, which isn't good. If you have thyroid problems, limit it to 1.75 ounces, 50 grams, a small handful, 2 to 3 times a week. If you have kidney problems, just 1 ounce, 30 grams, really small amounts, once or twice a week. Third, always cook it. This is really important. Eating it raw is the most dangerous. Always cook it. The best method is steaming. Here's how: boil water in a pot. When it's boiling vigorously, place a steamer basket on top and add the broccoli. Cover and steam for just 3 to 5 minutes. Don't overdo it or you'll lose all the nutrients. The broccoli should stay bright green and be tender crisp when you poke it with a fork. If it gets mushy, it's overcooked. You can also boil it. Boil water, add the broccoli, and cook for about 5 minutes. Discard the cooking water because the goitrogens leach into it. What about the microwave? Microwaving is fine too. Put the broccoli in a bowl, sprinkle 2 to 3 tablespoons of water on it, cover with plastic wrap, and microwave for 2 to 3 minutes. Never eat it raw. At salad bars or health food restaurants, they serve raw broccoli salads that look healthy, but they can be dangerous. Especially if you have thyroid or kidney problems, never eat it raw. Fourth, timing matters. When you eat, it matters too. Don't eat it in the evening, especially after 7 p.m. Eating it late at night can cause poor digestion and make you uncomfortable all night. You'll get gassy and have trouble sleeping. The best time is at lunch. Between 11 a.m. and 2 p.m. is when your digestive system works best peak digestive time. Eating it then ensures good digestion and nutrient absorption. Morning is okay too, but not on an empty stomach. Eat it with other foods during breakfast. And if you take thyroid medication, wait at least 4 hours after taking it. Fifth, know good and bad combinations. What you eat broccoli with also matters. Let me start with good combinations. Tomatoes. Eating them together is great. The sulforaphane in broccoli and lycopene in tomatoes combine for enhanced anti-cancer effects. Try stir-frying them together. Eggs, also good. The vitamin D in eggs helps your body absorb calcium from broccoli. Try a broccoli omelet. Olive oil, drizzle a little on your broccoli. Fat-soluble vitamins A, E, and K in broccoli are better absorbed with oil. Just add a drop or 2 of olive oil to steamed broccoli. Lemon juice, also good. The vitamin C in lemons helps your body absorb iron from broccoli. A little lemon juice on steamed broccoli tastes fresh and is healthy. Now for bad combinations. Milk or cheese. Not good together. The calcium in milk interferes with iron absorption from broccoli. Plus, it makes digestion harder. Avoid broccoli cheese soup. Sugary dressings, also bad. Some people pour mayo or sweet dressings all over their broccoli salad, but that just raises your blood sugar without health benefits. Better to use balsamic vinegar or lemon juice. Bacon or sausage. Avoid eating processed meats with broccoli. The nitrates in processed meat don't combine well with broccoli's compounds. Don't make broccoli bacon stir-fry. Alcohol. Not good. Together either. Alcohol irritates your stomach and makes digestion worse. Don't eat broccoli as a snack with evening drinks. Sixth, stop immediately if you have symptoms. If you experience unusual symptoms after eating broccoli, stop eating it immediately and tell your doctor. If you feel very bloated and gassy, what should you do? First, take a walk. Just 20-30 minutes of slow walking helps the gas pass. Walk around your house, or if the weather's nice, go for a stroll outside. Drinking warm tea helps too. Ginger tea or peppermint tea are especially good. Ginger and mint aid digestion. Gently massaging your belly helps too. Rub in a clockwise direction around your navel. Don't press too hard, just gently stroke. You can also find products like Gas X or Beano at the pharmacy. These help release gas. If these symptoms keep recurring, cut your broccoli portion in half. If that doesn't help, stop eating it altogether and switch to other vegetables. More serious are allergic reactions. If your mouth itches or your lips swell after eating broccoli, or if you get hives on your skin, stop eating it immediately. Go to the pharmacy and get antihistamines. Rinse your mouth with cold water several times. If you have difficulty breathing or feel your throat swelling, this is a really dangerous situation. Call 911 immediately. This could be anaphylaxis, a serious allergic reaction. It can be life-threatening. Don't try to tough it out. Get help. If you take thyroid medication and suddenly feel extremely tired, gain weight for no reason, or lose a lot of hair after eating broccoli, your thyroid problem may have worsened. Go to the hospital quickly and recheck your thyroid levels. If you take blood thinners like Warfarin and suddenly develop unexplained bruising, nosebleeds, or blood in your urine or stool, go to the hospital immediately. These are really dangerous signs. Never think, "I'll be fine in a bit," and ignore them. Wrapping up, living healthily with broccoli. Thank you so much for staying with me through this long explanation. Golden Age Lab always strives to provide accurate information based on scientific evidence. Everything I've told you today is based on actual medical papers and research. Remember the key points. Broccoli is absolutely not a bad vegetable. It's really, really good. It prevents cancer, strengthens your heart, and has lots of antioxidants that slow aging. It's high in vitamin C and fiber, truly an excellent food. The issue is who eats it, when, how much, and how. The same broccoli can be medicine or poison depending on how you eat it. People with thyroid problems, those taking blood thinners, people with kidney problems, and those with sensitive stomachs need to be especially careful. If you're in these groups, consult your doctor before eating broccoli. Even healthy people need to eat it in moderation. A palm-sized portion 3 to 4 times a week is enough. More doesn't make you healthier. It can actually be harmful. Don't eat it raw, always steam it. Just 3 to 5 minutes of steaming is enough. Lunch is the best time, avoid eating it late in the evening. Just following these guidelines makes it much safer. This is based on science. What Golden Age Lab has told you today is not personal opinion. It's all based on medical papers and research results. For detailed information, please refer to the description below. All these sources back up what I've told you today, so you can trust this information. The most important thing is knowing your body. What's most important? Knowing your own body. You need to know exactly what condition your body's in, what illnesses you have, and what medications you're taking. That's how you can judge whether broccoli will be medicine or poison for you. Are you taking any medications right now? Write down the names, or take pictures of the prescription bottles with your smartphone. Then when you go to the doctor, show them and ask, "Can I eat broccoli while taking this medication?" Keep your medical test results too. They show your thyroid levels, kidney function, blood sugar, etc. Use these to understand your health status for a healthy old age. Let me say one more thing before I finish. We can't stop getting older. Everyone ages, but we can choose how we age. Creating an old age where we stay active and can play with our grandchildren depends on what we eat and how we live now. Even with just broccoli, there's so much to think about. You might think it's too much trouble, but this is how you love yourself. Start today. I've said a lot, but really only 3 things are important. First, know your body's condition accurately. Check if you have thyroid, kidney, or digestive problems and what medications you're taking. Second, change how you eat broccoli. Don't eat it raw, steam it. Eat it at lunch instead of dinner. Eat moderate amounts, not large amounts. Third, watch your body's reactions. If your stomach hurts or something feels off after eating it, reduce the amount or switch to other vegetables. Just remembering these 3 things is enough. Start practicing today. Thank you so much for staying with me all this time. Golden Age Lab will continue to provide accurate health information based on scientific evidence. I wish you and your family good health. See you in the next video.